Welcome to Generous Impact. This is Brett Brummett.
And this is Amanda Brummett. We are joined today by Brian Allison from NMDP, formerly known as the National Marrow Donor Program, and Briana Donis, a recipient. In this episode, you'll hear how NMDP saves lives through cell therapy, and then you'll get to hear Bree's amazing story of being one of those that was saved. Well, Brian and Bree, thank you so much for both being here today. I would love it if you could just start by each telling us who you are, both personally and professionally.
Brian, you can go first. Oh, ladies first. Okay. So my name is Briana Donis. I am a 28-year-old woman. I personally am a individual just living my life day to day in the most meaningful way possible. Truly trying to be present all the time. Each day I'm a new person. So that's kind of just how I go with life. And professionally, I'm working as a HR project admin in the energy sector. And I also have my own small business on an Etsy shop. So I design t-shirts creatively wherever I can express myself. I'm just a very happy individual. I truly feel like that's where my light is. So I feel blessed to be able to find a way to share that with the world. That's who I am so far.
Beautiful. And you're going to get to hear more about Bree's story in a little bit and maybe why you have such an amazing outlook on life. Brian, how about you?
Yeah, so my name is Brian Allison. I am a dad, a granddad, a drummer, a fishing and off-road enthusiast. Professionally, I am the account manager for NMDP in Southeast Texas. August will be 11 years with this organization doing what I do. So I always tell people they're going to have to run me off. I love what I do.
That's awesome.
I feel like I've found so many drummers lately. Just this weekend, we had a realization that on my 40 to 50-year-old old man baseball team, 5 people own drum sets. So I'm just going to ask, what brand of drums do you own?
Currently, Yamaha.
Okay, there we go. Just had to find out.
Yeah.
It seems like a weird serendipitous of life.
I've been a big Mapex fan for years, and within the last year, thought I would try something different. So branched out to Yamaha.
Yeah. Well, let's get on the professional side, Brian. And I want to see if you can, I know you can, but would you mind telling us a little more about what NMDP does? And I'll just point out real fast that you guys were formerly known as the National Marrow Donor Program and Be the Match.
Yeah, absolutely. So let's start off, if you don't mind, let's talk about this name change because it has taken a little bit of getting used to. When our organization was started, it was the National Marrow Donor Program. So hospitals shortened that and they called us NMDP for years. I guess around 12 years ago for our public facing, our recruitment department, we adopted the name Be the Match because we wanted something kind of catchy, but that we learned over the years has created some confusion. We had all kinds of people that thought we were a dating service. We're not. We do hook you up with the most awesome date you can find, but not quite the romantic thing. College students would often think, okay, these guys are setting up on our college campus. They thought we were trying to hook them up with an internship or match them up to a job. So it kind of created some confusion, even with our patients, because we would talk to these patients and say, hey, Be the Match. We would like to work with you to share your story. And these patients would say, well, that's great, but my doctor is not searching Be the Match. My doctor is searching NMDP. So the hospitals really never quit calling us NMDP. And, to make it simple, less confusing, we kind of went back to our roots, so to speak. The hospitals call us NMDP. So we are now all under the NMDP umbrella. What our organization does, we work with patients who have been diagnosed with some type of blood illness. A lot of those are leukemia, lymphoma, sickle cell, and aplastic anemia. Those are probably the most 4 common, but there are about 76 illnesses that are curable with a stem cell or marrow transplant. The problem is when someone is told you have to have this transplant for survival, 70% of those patients don't have a donor in their family. They are relying on a stranger to cure them or to save their life. That's where we come in. We are out in your community every day, everywhere in the United States. We are advocating for those patients, raising awareness of the need for donors. We're educating people on, if you were a match for a patient, this is what your donation would look like, because there are a lot of misconceptions and misinformation about stem cell and particularly marrow donation. So we're educating people, and those people that want to step up and help our community, we help them get into the national registry that hospitals, not only in the United States, but globally, are relying on to help find those unrelated donors from the United States. So that's kind of what we do. It's a lot of community health education.
And then I know you said there's a lot of confusion around stem cells versus bone marrow. Has that gotten better, or is it still just very confusing for the public?
There are still a lot of misinformation out there. The biggest thing, when people hear bone marrow donation, they automatically think huge needle. They think somebody's going to drill into me. It's got to be super painful. That is the biggest thing that we battle to overcome. What we want most people to know is 90% of our donors now are asked for stem cell donation. Stem cell is actually the more common, and it's actually collected through an IV in your arm, similar to plasma or platelet donation. Does it hurt? It's a simple needle stick. It's not super painful, but it's like a prick, nothing major. And for those that the 10% of our donors that do marrow is actually collected under general anesthesia. The donor's asleep while they collect it. When you wake up, those muscles, they collect right above your butt. Those muscles are a little bit irritated, just like if you had a COVID shot, flu shot, your arm was sore for a day or two. It didn't keep you from going about your daily routine. Same thing with marrow donation. You're going to know that you did something, but it's not going to be excruciating to where you can't go on with life. So often I hear our donors say, "Oh, I feel like I did squats," or "I feel like I did heavy leg day." Our donors from up north, something we're not familiar with here in Texas, but our donors up north often say, "Oh, I feel like I fell ice skating." So it's not a big painful thing like most people think it is. And that's the biggest reason people are hesitant to sign up, because they think it's going to hurt, and it doesn't.
Well, I mean, and I'll have a soreness or a pain for no good reason. Please let it be because I'm actually saving
I,
someone's life.
you know,
That would be
I'm,
great.
I'm
Right.
45 years old. I hurt myself getting out of bed sometimes in the morning. That's just, part of getting older. But yeah, I'm like you. I'm like, a little bit of discomfort, giving somebody a second chance at life, that is a totally worth it trade-off.
Absolutely. Well, so Brian and Brett and I both work in the healthcare space, and neither of us even knew about NMDP until Cheyenne, Bree's sister, shared her story in the organization with me. I'm an organ donor. I've done all the registry and all the stuff for that. Never even knew I needed to sign up to be a bone marrow donor. So I'm so glad that Brian, that you dove in with the ask right up there. We want everybody to go sign up to be a donor. So Cheyenne, Bree's sister, brought me to NMDP, but I want to know what brought you guys to it. And Brian, I'll let you go first, and then Bree, tell us how you found the organization.
Oh, mine is kind of a loaded question. So people hear my background and they wonder, how in the world did you end up here? So I started off life working in public safety. I was a paramedic and a police officer. When I was going through the police academy, one of my coworkers, his daughter was born premature and needed blood at birth. And I was that guy that was terrified to donate. And when I say terrified, I am the guy that I don't do needles. I just know. So unfortunately, the day after my friend, his daughter was born premature and needed blood at birth, the next day at our police academy, here rolls up the blood bus. And I couldn't be the only cadet that didn't give for his friend's daughter. So I
Right.
got on that bus and donated. Guess what? I didn't pass out. I didn't get sick. It didn't hurt, but I got to see the good that it did. Fast forward about 10 years or so, I needed a career change, had no idea what I was going to do, went back to school and got a degree in marketing and was actually donating blood. And the phlebotomist was kind of picking at me. He said, "So what are you going to do with this new fancy degree that you have?" And I joked and I said, "I guess be unemployed." And he said, "Well, you're passionate about donating. You should consider applying. We're hiring somebody here for the blood center." And that's how I got started, was initially as a blood donor recruiter. And we had the Marrow program within our blood center, and I fell in love with the program. The biggest thing that drew me to it over the blood side of operations was the fact that they got to work with patients. And I really love patient care. I loved that about being a paramedic, getting to help people. As a representative for NMDP, I get to do the same thing. Imagine hearing your name or your mom's name or your kid's name followed by a diagnosis and a defined amount of time to live, unless you can find this stranger that's willing to help. That's where I come into these people's lives, and I get to say, "Hey, I'm this crazy bald guy that's willing to go just about anywhere to share your story and help you find this stranger that's going to save your life." And I get to give them back that little bit of hope. And that's what I love about what I do.
That is incredible. All right, Bree, I know you didn't go searching for NMDP, so how did you end
No.
up finding them?
So I had been diagnosed with severe aplastic anemia, and it was part of my options for treatment. It was, I think, the second or third option. The first option they really want to go with is a related donor. They tested my family. No one was a match. No one was a partial match. So they said, okay, well, let's go to the registry and see if you have any matches there. And Be the Match was who they went to, the donor program they went through. And they were pretty close by each other, the hospital and Gulf, the regional Gulf Houston blood place building where everything's at. So they reached out to them, and I had so many donors. So I got in contact with, I guess, whoever was representing me, and we just started our journey from there with my medical team. And the relationship grew. It wasn't just a hospital medical team. Be the Match really got to know me as an individual. We did a lot of work together. I can't even remember all the things that we've partnered on, but I think they appreciated that I was 18 years old at the time and I could advocate for myself and what that meant for my health, and really recognize what was going on, an awareness of how incredible this organization was and what it was doing for my life. So we've had a lot of encounters. I actually, through Be the Match and NMDP, they set up a donor meet at their annual Be the Match get together in their headquarter location. So I actually got to meet my donors because I had two donors. I had two transplants. The first transplant didn't go as well as they had hoped. It didn't graft. So then we went back to the registry and found another match and did that. So I got to meet both of them through Be the Match. So I mean, I think I'm partnered for life, really. Whenever they call me and they're like, "Can you?" I'm like, "Yes." When and where.
Well, and I could tell just when we got on the Zoom that you and Brian, you've got a friendship that has grown over the years.
Yeah, we
Yeah.
actually, I guess I worked with him, but it was kind of like an internship in the summer. I really wanted to explore that path, and he even reached out one time about an opening position, and then that one just didn't go that way. But yeah, through the years, and I feel we're connected. Brian's a really easy person to get along with, talk with. Truly, you can feel his passion. I mean, I think he's the best representative for Be the Match or NMDP.
We're all going to learn to say the new name
Yeah.
eventually.
Mhm.
And Bree, not to like bring down the mood, but just so that people, fully understand what you went through. I mean, what kind of condition were you in when you set out to get your transplant? And frankly, what would your prognosis have been without one?
Oh my. And that's a good question. I've never had that question before. So I was 18 at the time. I was in soccer and living a very active high school life. It was my last semester of high school. It was actually I'd just been crowned homecoming queen. I had just been accepted to the UT Austin. I was preparing to crown the prom queen. All that you can think of was happening in my life. Well, I started to feel more fatigued than usual. And I had actually decided for the second semester not to do soccer that year. I just wanted to focus on other things, my schooling, and it didn't make sense to me why I felt tired. If I'm not doing soccer, then why do I climb the stairs and I'm winded, completely winded, bruises all over my body? And I started to think, that's weird. I only got bruises through soccer, but I'm not playing soccer right now. And I don't remember hitting myself. Lost color in my skin. And I just, you write these things off. Just thought, oh, okay, I'm just more pale. I need more sun. I'm not playing soccer. It's winter time. Lost color in my lips. I thought, okay, that's weird. Just put lipstick over it. No biggie. I like lipstick. This might be TMI for some people, but I was a woman and my menstrual cycle was different as well. There's something called platelets that help with clogging the blood and stopping it from just flowing everywhere. You heal, it makes scabs. Didn't have those, didn't know at the time. So my flow was extremely abnormal. I had to set timers through the night just to take care of whatever I need to take care of. A 30-minute timer through the night. So I get 30 minutes of sleep, wake up, 30 minutes again. It was really concerning. And so I brought it up to a family friend and they didn't want to scare me, but they had also had a family friend that went through leukemia and they recognized all the signs and they were like, okay, don't want to scare you, but think you need to go see a doctor. And it really was scary when it got to the point where I started popping up with dots, petechiae all over that situation. So I go and they diagnose me, I think 2 days later, get my blood drawn. And they say, oh, we'll get the results to you next week. No, ring a ding a ling. They call me and I was 30 minutes away from Fiesta, Texas in San Antonio. And I had to turn back. They were like, your life is at risk. You need a blood donation right away. Being 18, I was like, I'll be back. I'll be back tomorrow and we'll take care of this later. The doctor was like, no, you need to get back right now. I'm not sure how you are still like standing without fainting. And I was like, oh my gosh, my blood levels were so low. So I was diagnosed 2 days later with severe aplastic anemia. And had I not received treatment, I actually a bit familiar with how my life may have looked if I didn't have a donor. I made a lot of friends on the bone marrow transplant unit at Texas Children's, all different ages. Lost a few friends to not having a match and having to do different ways of going about it, like half matches and just not even having it and trying other treatments. And I feel truly blessed and lucky to be alive because that's not always the case.
Yeah. Wow. Well, I'm so thankful that you found NMDP and that you were able to have a second successful transplant.
Me too.
Yeah. So I have a question for both of you, but it's just ignorance on my part. For the transplant area, I'm guessing, unlike a blood bank, you're not able to store the stem cells or the blood, so it has to be alive or close timing.
So not exactly. Previously, yes. So something that is new on the horizon, we know there are certain donor tissue types that are requested more often than not. So we do so much more at NMDP beyond just transplants. We do a lot of research, and one of the things that they are looking into is called a biobank, to where we can contact those young healthy donors that we know tend to be more requested, and have them donate before they are an actual match and freeze those cells. Very similar to cord blood banking. Those, we know with cord blood, they can store those cells, liquid nitrogen, and preserve them for up to 10 years and retest for viability. So that's definitely something that is new, and we expect to see more of. At the time that Bree was going through treatment, that was not an option. So you would have your person who matched you donate, and within 24 hours, usually you were getting those cells. So it's a very short time from donation to reception.
And remind me, Bree, I think yours came from Costa Rica and Mexico.
From Puerto Rico.
Rico.
And my other donor, I think his origins are from Mexico, but he was from California. Yeah, so just wild. And it just amazes me that that's even a possibility.
Yes,
that
in 24 hours. Yeah.
Yeah. Uh-huh.
Well, and I've also kind of, in my mind, as I'm listening to the story and taking in, I've made Brian like your friendly stalker. Like he's hunting down in secret the match.
Yeah.
Looking around the corner, sneaking up on, I need you.
Brian, I feel like Brett's picking on you today.
One of the phrases that always bothers me when somebody's turning me down to be recruited is when people say, I'm good. And that bothers me, in the fact that someone's on the other end that is not good. But that statement alone, I'm good, is exactly why we needed that person as a donor, because they are good. So I kind of feel like that stalkerish. I'm like, I know you're good. Let's have a conversation. Maybe I can change your mind and change your heart in just a couple of minutes. So yeah, I kind of like that in a friendly kind of way, for sure.
Yep. And well, you've turned a few, you've tracked them down, you've gotten them to be good for somebody else. I mean, I'm looking through the stats, and 125,000 plus transplants, and then 6 million or more in patient assistance through that. Like, those seem like really big, hard to quantify numbers. Like, how does that really change the impact, or what impact have you guys had, and what does that look like in the general landscape of everyone that's still going through or needs treatment?
Yeah, I mean, we facilitated more than 125,000 transplants since our organization started. That's hope for people. Used to, when someone was diagnosed with a blood cancer like leukemia, lymphoma, a blood illness like severe aplastic anemia, that was a death sentence years ago. And now it doesn't have to be. We see miracles like Bree every single day. That a big part of my job is that I love is what we do for patients. And, one of the first patients that I worked with when I started this job 11 years ago, is she was little bitty. Now she's a college student. She's engaged to get married, and we get to see those happen. Those numbers, those statistics, those are great numbers and statistics, but getting to see the real people, that's what we want others to know, is these are not just numbers on paper. These are people's lives that we are saving, that would not be here had it not been for this organization and the generosity and kindness of a complete stranger.
That's super, super powerful. And tell me a little bit, do you guys work full national scale?
Yeah, so NMDP is the National Stem Cell and Marrow Donor Registry program for the United States as well as Mexico. So there are other registries. Each country typically has their own registry, and we're all interconnected. So if a hospital starts a search for a patient, they will typically be able to look not just within our registry in the United States, but they can search for a donor internationally if we don't have one here in the US for that patient.
And then, Bree, I kind of jumped the gun on it a little bit, and we talked about your amazing survival story, which you guys can't see Bree's face, but we're looking at a 28-year-old, healthy, beautiful, vivacious young woman, which, Brian, to your point, I mean, there's your statistic, there's your impact. Bree, any thoughts from you on the impact of the organization?
Man, yeah, it's exactly what Brian said. To anybody outside of the situation, it all looks the same. And honestly, for myself, I wasn't aware about this before it happened to me. Neither was my family. And now my family, they're all advocates. I mean, Cheyenne told you about it. That just makes me so happy. But the impact is huge. And not only is it just with that individual whose life is saved, the impact that that made to all the lives that that one life touches is, you just can't count it. Priceless. Truly, like what Brian said about the first individual that he worked with, and now she's married and all grown up and healthy. To me, in my mind, it contrasts the little girls that I knew that passed away at 7 and did not get to see that because they did not have a match. So I'm just imagining, what if we had that one person? That one person was the match. It really is the difference between saving that life or not, because you're given a second chance when you do have a transplant donor. But if you don't have that, I mean, where is your second chance? Not everybody gets that. It truly, truly, truly is impactful. I mean, there's just so many ways that the whole experience has impacted my life forever, ways I probably don't even realize. But definitely, I have a different perspective on life because of it. I understand what was at stake and what that meant for me. And maybe it was because I was older and I could process that. I'm just forever grateful for its impact.
I don't know. Most of us are not wise enough at 18. So I think you might be wise beyond your years. Maybe dealing with something like aplastic anemia gives you that wisdom.
Oh man, definitely, 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 definitely. It makes you look at everything. You, I mean, maybe it is my mindset. Everything changed, and I had to look at myself really hard and literally look myself in the mirror and digest, process what was happening, why it was happening. I'm going to be okay. There's just so much during that process that you're putting your trust in other people, your medical team, your body that you don't really have control of. Registry, a donor registry, those people working for that registry, what they're doing, your nurses, your staff, whatever. There's so much that you have to just let go of and trust. And so it changes life. Your life is just forever changed.
How often, Bree, do you have moments where you either break down with like joy or tears when you re-experience things that you know you wouldn't have, like first time you went? I'm assuming you've gone back to Fiesta, Texas.
Yes, I
Like,
have.
what is that like surreal experience of time and place been for you?
Yeah, so definitely after maybe like a few years, I had a lot of those moments where I would do something that, man, I almost thought that I wouldn't be able to do this, or I'm so grateful that I can. And it really makes you think, there are people out there who don't get to do this and they have no choice about it. There were moments during the journey, because it's a whole recovery process. You have a bone marrow transplant and that's not it. You're not just like, well, there's 100 days where you're closely monitored because your immune system's so weak. And so I experienced a lot of those joys that you're talking about during that time frame, like taking a shower, taking a step outside without a mask, leaving my room, rebuilding my muscles. I lost probably about 20 pounds when I was in the hospital, and getting my strength back, being able to eat. Oh my gosh. That was a relief. Living normal life, that really is just a blessing. I remember the first time that I was able to eat pizza. I can't remember why. Oh, I remember. So when your immune system's low, they don't allow you to go out and eat regular food. You can't go to a restaurant. You can't go to a buffet. It has to be cooked at home because of the risk of being contaminated, getting sick. So the first time I was able to eat pizza after my immune system had recovered, I was crying, eating the pizza, just like sobbing. Like, I am so grateful. The first time I was able to take a shower by myself without my PICC line, crying, extremely grateful. And the moments that make me cry now and really realize what I have is when I tell the story again and I remember the friends that I have lost. And just, I mean, that gets me pretty much every single time. There's just no forgetting what I have when you really contrast it. So it's those moments that just touch me.
Yeah. And probably will forever.
Probably.
Yeah.
Yeah.
I mean, let's hope they do touch you forever, because that means you're surviving and thriving and you have the perspective.
Absolutely.
Yeah. Well, looking towards the future, Brian, what's next for NMDP? And then Bree, I want to know what's next for you.
It amazes me the things that science is coming up with. The biobank ability. We now have a program that's called HLA Today, where they are able to use donors who are less than a perfect match and have the same outcome for patients. And what that means is so many more people will be cured and have that second chance that never did before. And it's just so amazing to see the things that we're able to make happen for patients that were never able to happen before. It just means so many more people are going to be able to be helped. And that to me is incredible. Working with so many patients over the years, seeing these patients, because their race and their ethnicity play a very key role in whether or not they'll find their donor. And, some of those patients had less than a 30% chance of finding a match. And to see those patients now have the equal opportunity to find a donor just like everybody else, because we're not having to find necessarily that 100% match, getting to give that to people, that's where our organization is headed. And so many lives are going to be saved. And it's just an amazing thing to me.
And then Bree, what's next for you?
That's
it
really amazing.
Doesn't have to be anything doing with bone marrow. We just want to know what you're up to.
Oh man, my perspective on life is constantly evolving. And like I said earlier, I'm a new person every day. And I truly live in the present as much as I possibly can. So what's next for me? I really don't know. But what I do know is that I am always open to something new, to a challenge, to an opportunity. Like these are the moments that I'm like, oh, a lifetime will always contribute, will always find a way to share this story. And I think my strongest way of being an advocate is just living my life and showing people a different perspective, something that I gained from the whole journey that I went through. And every chance I get, I share with them about Be the Match, my story, my journey, and hopefully inspire some people. And I definitely have along the way. I have friends, partners that have joined the registry because of my life. So I think that that's the best I can do every day moving forward. Professionally, I don't know. I'm a little weird person, I think. I think it's not all about the profession for me, at least in my journey. It's not. It's about the quality of life that I live with the people that I love and who I touch and connect with. Through that, I think that's where I make my impact. So looking forward, I'm just going to keep living my life the best I can. Yeah.
That's really cool. I mean, and I'm sure you have learned to just see that divine spark of the daily life
Yeah.
as anywhere you go.
Absolutely.
Yeah. All right. So super inspiring from what you guys have been through, what you're going through, and the mission you're on to help others. Where are you gaining outside inspiration to help fill your cup outside of NMDP?
That's a hard question for me. I kind of get fussed at sometimes for not separating the work from the life side of things. To me, you don't work in this line of, this career without the two being very tightly integrated. My patients become family. I get invitations to birthday parties and weddings and christenings and all kind of things. I just watching these people that I get to work with, being part of their lives and seeing even for those that don't survive, there are plenty that don't make it, and getting to be part of their parents' lives and see them go on with life, after they've been through this horrific thing. For me, it makes me appreciate the little things. When I get sick and I just, you want to feel sorry for yourself on some of those days, but then you think of all these people that have been through much worse. It really puts things into perspective for me. You realize working in this, how fortunate you are. You take things for granted in our everyday life that, just some people don't have. And it's not something I differentiate between the two. And unfortunately, but it's had a huge impact on who I am and how I live my daily life.
For me, similar to Brian, really, the inspiration is from others. It's not my line of work, but it's just that powerful that I would understand being in that line of work. That is something that just is symbiotic. It just works so beautifully together. I draw my inspiration just every day from other people, the things around me, the beauty and the small things, the small moments. Family is so huge. And honestly, they're a gift. And so for me, a lot of my inspiration comes from my loved ones and growing with them, growing.
That's very cool. I'm glad you guys are able to share that with us. So my last question for you guys, and maybe it's more practical than anything, but what can our community do for NMDP? We don't care about NMDP. What can our community do for those that you provide matches with? How do we do it?
The first thing is, obviously, if you're eligible to register, go register. If you are between 18 and 40 years of age and you are healthy and you have the heart to help a stranger, registration is super easy. You don't have to find us. All you have to do is text the word hope to 61474. We're going to send you that swab kit in the mail. Swab at home and turn it back in. It's prepaid, it's free, it's easy to do. But more importantly, be committed. We unfortunately have seen, especially since COVID, we have seen a huge decrease in the amount of people who are actually willing to donate when they get that call. It's not enough just to fill out a form. It's not enough just to send that swab back in. Do this with the intention that you're going to help somebody. Follow through with that commitment. It means a big difference. Beyond registering, in doing this job for over a decade, I've heard both of you say on this call already, we never knew this organization existed. And every patient family that I have ever worked with in 10 going on 11 years never knew we existed until they needed our help. If you're hearing this program, if you're listening, every one of us have some type of social media. If you heard me say 18 to 40 and you're over that age, if you're overqualified like I am, you can still be a huge advocate. We have our national NMDP Facebook and Instagram, but we also have our regional pages. I'm in Southeast Texas, so we're the NMDP Southeast Texas team on social media. Share those social media stories. That's where we help get those patient stories out. It doesn't cost you anything to hit like and share. And we have found so many donors that were just sitting, sipping coffee and came across a Facebook post and thought, why not? I'll take a couple of minutes and fill this out, and also in a more direct way. My territory alone, we cover a huge territory in Southeast Texas. And there are only two of us who are actually employed that are out in the community. We always need volunteers. There is no age limit to volunteer. We have people that, they bring their kids along with them. They bring their significant other with them. They bring their dog with them. There's no excuse for not getting involved and helping out. There are so many different avenues you can help. We even have patients that are, like Bree said, they're immune compromised. They can't get out in public and do things. We have elderly volunteers that their health doesn't allow them, but they sit at home and they label the swab kits for us that we use at donor drives. There are so many ways that people can get involved. And I just encourage, if they go again, that link that they can text forward, they just text the word hope to 61474. That takes you to our webpage where you can learn more about the organization. You can register from that as a donor, and you can also register as a volunteer and see what's going on in your community. Get involved. That's the biggest thing I ask. Get involved. Be a voice for these patients that are in need.
Perfect. Well, thank you so much for letting us know how to do it, what we can do, and then really just for sharing your stories and backgrounds and your heart for helping others and instilling life.
Absolutely. And, it's amazing. One little story that I want to share before we part is I really met Bree well after she had gone through her transplant. She was healthy and started volunteering with our organization and was interning with us. And at that time, I was our patient and hospital liaison. So I spent a lot of time in the Houston Medical Center. And I dragged Bree one day with me to Texas Children's Hospital. She had not been there in years on the transplant floor. And I don't know if you remember this day, Bree, but she was very excited to go back because she had not been there, but she was also curious who was still there staff wise that she recognized. And I don't think she realized the impact that she had on the nurses and the doctors that were working there. It was so cool to see some of those nurses that were like, oh my gosh, you're all grown up. You were that. So they knew her as the girl that did yoga in her room while she was going through transplant. They were like, when she was having these really bad days, she was in her room doing yoga, and that's what got her through her bad days. And she left that lasting impression on so many people. So, this is a two-way street. We have a great impact on patient, but those patients leave a big impact on us too. And I hope Bree realizes how much of an impact that she has left on so many people through her journey.
Thank you, Brian. It is, like I said, you're not just impacting that one life that's saved. I realize now, you touch so many people, so many lives. Every day is an opportunity. Every moment is an opportunity to impact somebody positively. And I really feel like that's my gift. That's a purpose that I take personally and passionately within my own life, my circle, whoever I touch, is what impact am I leaving with these people?
That's amazing.
Thank you.
Yeah. Thank you so much for being impactful for us today.
I'm glad we could do this.
Yeah, what a beautiful way to end generous impact with Bree's impact.
Yeah.
That was a great tie-in. Thanks, Brian.
Absolutely.
Wow. I don't know about y'all, but thinking about the young ladies that Bree met through treatment that didn't make it really got me. I wish I had known about NMDP before my window to be a donor closed. I hope you gathered inspiration from Bree's story and will sign up to be a donor if you are able. And if you aren't, Brian shared a ton of ways to get involved. Find them at bethematch.org.